I want to thank everybody for being here. Welcome to Covering COVID, Investigative Journalism, and the COVID-19 pandemic. My name is Mark Greenblatt. I am the president of the board at the Fund for Investigative Journalism, and I am thrilled to be here with just a rock star, all-star panel, and I'm looking forward to learning as much as I hope all of you do today from this panel. What I do outside of the Fund for Investigative Journalism, my day job, I am the Senior National Investigative Correspondent with the Scripps Washington Bureau and Newsy. I'm also flanked here by Anu Narayanswamy, who's a data reporter at the Washington Post and one of our hardworking members of the board also at the Fund for Investigative Journalism. We are very honored to have with us. He's going to be mad at me for using his official title, but I'm going to use it nonetheless since he went to school and earned a doctorate, Dr. Ivan Oransky, Vice President of Editorial at Medscape and co-founder of Retraction Watch and President of the Association of Healthcare Journalists Board of Directors, who's co-sponsoring this event along with FIJ. And we thank you for that co-sponsorship and for gathering everyone together and the resources of your organization. We also have with us Morgan Baskin, who is an independent journalist covering social welfare, who received a grant from the Fund for Investigative Journalism for a story that she published this month in the Washington City paper, uncovering aspects of the Washington, D.C.'s child welfare agency's handling of COVID-19. This is an awesome story, and I can't wait to speak with you about it as we get into this, Morgan. Derek Kravitz is also here with us. He is a fellow at Columbia University's Brown Institute for Media Innovation and part of a team that received a grant from the Fund for Investigative Journalism to collect and report on state and local governments' responses to COVID-19. The team that Derek is working with, the reporting team, has already produced stories that have ended up in the New York Times, Washington Post, Kansas City Star, and other outlets. They're doing some fantastic work, and we're gonna dig in and understand what they're doing. And I can tell you that one of the things that I'm most excited about having these people and their minds together in this conversation that we'll have all in one place is that not only can each of these reporters and also leaders of the journalism field help you understand what they've done, but in the spirit of both organizations, what FIJ does, what your organization does, Ivan, what IRE is famous for doing, we get to steal each other's secrets and learn how we can localize different stories that have been done elsewhere, learn what records to ask for. And not only is it our hope that we can all learn together about how to do great work, but the good news is that FIJ has money that we want to give you. We have an open grant right now, an emergency rolling grant process, where if you get a great idea from something that you see in this panel, you can apply at fij.org for a grant, and we will give you money. And in addition to money, we will give you a blanket of support, everything from mentorship that is thanks to the generous support of the Scripps Howard Foundation. And we also have support from the Reporters Committee for the Freedom of the Press to even give you legal support if you're getting into any real hard-hitting work. So that's a great opportunity to learn today and to hopefully be inspired and hopefully get support in doing what couldn't be more important work right now. It's worth noting at the top of this call as we dive in that the numbers, as we all know, of people testing positive for coronavirus are just going through the roof as America begins to reopen. And so the stories that you can do right now literally could save lives. It's that important. And that perhaps is why I'm so grateful to have convened this, this really tremendous panel. And perhaps it's worth talking and beginning for a moment with one of my co-board members, Anu, over at the Washington Post. Anu, you've really, you are sort of a data guru for the Washington Post, and you've worn many hats, and you're digging into many things. But right off the bat, I'm sort of interested in just what are you watching right now from a data reporter's perspective at the Washington Post when it comes to COVID-19, as far as trying to come up with story ideas, and what sources of data are interesting to you?
When it comes to, there's a gamut of different things that we are trying to look at. And I'm particularly interested in the politics side of things, but I will talk a little bit about what the Post is doing overall to collect data, as well as what I've been doing for some time now, since March. So it comes down to essentially counting the number of cases and the number of deaths. There are various other sources which are out there. Everybody talks about the Johns Hopkins data, which is where it all starts, but most big news, national level news publications are also collecting their own data in terms of research and reporting, and finding out what local counties are reporting, what local cities and states are reporting at the local level, so they can actually accumulate and add up that data at their own level. So that is one of the efforts that is happening at the Post. Other than that, there's been a keen interest on looking at the other part of COVID, which is how the government is reacting, or what they're doing in these circumstances. So it includes things such as the CARES Act, the SBA loans which are being given out, what other kind of monetary benefit is either the SBA or any other government organization giving out in terms of loans, grants, contracts. And all this data in some manner is available via government websites. And this is something which has happened over the last month and a half. Initially, we didn't see any of that data. So Eric might share some of these links with you at some point during our conversation, but let me just go over all the data that is available out there. HHS has a really good listing of nursing home deaths. While this data is there, when I've gone in, I've seen a lot of problems with the data, such as some places just not reporting anything. And they are by law, the mandate is that they have to report it, they are not. So that is something that people at the local level can be looking into and saying, what's happening in this state or this region? Why aren't there nursing homes here reporting something? And I think that's a treasure trove for localized stories. HHS is also putting out data on every loan or grant that they have given out under the Provider Relief Fund, which is essentially for your localized clinics or bigger chain hospitals and anything medical related. It can even be your specialized, clinician that you go to or something. HHS is also putting out every contract that has gone out via some of their programs. And this includes both Provider Relief Fund, which is related to medical agencies or otherwise. And one other really useful resource that I have found is Fact Squared, which essentially puts out a lot of data that is, or money given out or loaned out to publicly traded companies. And this is something that made a wave right in the beginning, where you found some of the big companies getting money. People didn't think they deserved that, and then the money being given back. So Fact Squared actually goes into the SEC records and looks through them, and it's a scraper and brings out data about what's being given out to these publicly traded companies. And another fun tip is that the rest of the PPP data is going to come out anytime as of this week even. So that's another thing to keep a watch out for.
Super interesting stuff on that. I'm interested in with respect to the PPP area, since that is imminent for people. What would you recommend folks look at if whether they're a reporter locally or nationally when that drops?
I think locally it's about who's getting these loans, right? And the question is, do they need it? The mandate is that they have to have X number of employees, and the idea is that these employees should not lose their jobs. So what is happening at the local level? Are they still getting people to leave their jobs, or are they being pushed out, or are they being retained because of the money that they are getting? What is happening at the localized level? And that's something I would be really keen on looking at. And of course, in the larger aspect is about conflict of interest, what's happening between politicians in the area, and between what's the link between these. Are they getting a special kind of treatment? What's going on?
I wonder if you could spend one moment, Anu, in just telling people there may be people of various levels of experience, some very advanced data reporters on the call, and perhaps others who have not delved in but wish to delve in and wish to try to learn the skills, some of those that you have. What would your general guidance be for those people, and what cautions would you walk them through? There's data everywhere. How do you know if the data sources that you're citing are reliable enough for you to put your name on and to report from in this important space?
Right. So all the data sets that I have talked about right now don't need very advanced data skills. And by that, I mean, you will be able to just download them as a spreadsheet and start taking a look at it. It doesn't require any additional skills. And this is what I call basic. I understand some people may not have that, but even if you don't, it's very easy to learn. Just a small tutorial will take you through how to quickly sort a spreadsheet where you get the topmost number or the highest number to the lowest number very easily. So just with those basic spreadsheet skills, I think people should be able to navigate most of these data sets. And as per looking at something and seeing if it is accurately portrayed, I think one of the best tips I can give people is pick up the phone and call. Just because you're a data reporter does not mean you don't make calls. In fact, you would likely get something wrong if you don't make those calls to make sure you have the data and you're doing the right thing with that data. So that would be my biggest advice.
So for the people who have joined this call and are here not for the recorded version of it online, but are here live, it's important to tell you this is an interactive conversation. We intend it to be. If you look down at your chat window, you'll see not only links that should be popping up that are relevant to things that speakers are talking about, but we encourage you to actually put your own questions in that area. And Eric Ferrero, our executive director at FIJ, is monitoring that chat, and we'll make sure that those questions get addressed as we move forward. So there's that to remind everybody about. As you hear something that's interesting that you want to know about, please do interact with us. You know, it's a good transition to talk about also, before we move on to Ivan as our first panelist. You know, I would offer that there are a couple of lessons that I've learned from reporting in this arena. One is that if you can think about the ways that whatever subject you're peering in on may be really vulnerable or ripe to be, there are sometimes older issues that have been out there in society for some time that right now, COVID and other items that are going on in our national conversation with respect to race relations, which is also tied in very, very deeply to the discussion over COVID. You know, many of these issues have been around for a long time and no solution has come about. One of the things that the team that I've worked with at Newsy has figured out how to do is to take a look at these issues and then really try to hold people accountable in the context of what's happening in our nation right now. And I would just encourage you to look at old issues that remain and just take questions to those in power and try to hold them accountable. One example of this is in the economic impact of COVID-19. Early on, many of us were very quarantined and very much staying at home. We had stopped driving our cars. This was not a life or death issue of a story, but we had came in at the right moment, I think, and re-propelled an issue about how we were all paying too much for our auto insurance, that we were paying to be insured with our cars, for driving when nobody was doing any driving anymore. And it was an issue that certain advocacy organizations had highlighted before, but what we essentially did was simply call up all of the insurance companies and really held their feet to the fire as to if they would continue to essentially overcharge consumers for auto insurance. And the long story short on this is that by continuing to push and continuing to hold the insurers accountable, eventually Allstate did respond, and they decided to issue a refund, a big one, hundreds of millions of dollars to their insurers, and that was followed up soon by sort of a wave of reforms that no auto insurer wanted to be the insurer on record of overcharging people in this kind of environment. And as we get deeper into conversations about stories on any topic, I think that there are many topics that are ripe for similar approaches, both locally and nationally. One area that's a great area to transition to Ivan on that we delved into as well was trying to figure out how to trust the information that is out there on COVID-19, the medical information, the research that's in journals. We asked some simple questions and wanted to know, beyond breathing in and perhaps acquiring the coronavirus, COVID-19, through respiratory methods that have been getting a lot of very, very needed attention. We asked a simple question: what about the exposure route of the eyes? And did some reporting in that vein. And what I found was that this has since been talked about quite a bit, but what we found early on was that there have been some great medical journal articles on this sort of in this medical space area that are just ripe for digging into and reading a lot of information about, whether you're using PubMed or other sources to find what the CDC has written about in CDC funded work or others. There's some really interesting information out there for all of us to mine that might not be a brand new report today, but that you might be able to look at. Well, what was studied 2 years ago? We were able to do that here and publish some good information about exposure through the eyes. But that's one of the things that Ivan is a specialist at. And Ivan, one of the things that you really do is you're able to help people understand what is a good journal article, what's a reliable one, and which ones should we not be able to trust. And it's a really tough question. There's been some famous misses even by some very renowned journals of late. But I'm interested if you could help us in this important time know, when you hear these reports that a new journal article is out, how do we know whether or not we should trust it, or as reporters, whether or not we should pass it on to our various audiences?
Sure, that's a great question, and thanks, Mark. Thanks to the fund for joining forces here with HCJ today and having given me the opportunity to tell you a little bit about. I'm going to talk a little bit about my work, and that's relevant there in terms of journals and in terms of how to know what to trust, if anything. And then I want to talk a little bit about how HCJ is helping to do that as well. So maybe we'll have a couple, conversation about that. Mark, you alluded to some big misses. There were a couple of really high-profile retractions just a few weeks ago, so early this month, involving The Lancet, which is one of the world's leading medical journals, New England Journal of Medicine, another one of the world's leading medical journals. And what linked the two was that it's sort of interesting and cool to be talking about data today with all of you in a way that I think about data, which is slightly different, although we of course do data journalism at Medscape and other places that I've of course worked and we supported at HCJ. But I think about the data behind particular studies. And so these two studies were based on what I would call sort of alleged or sort of purported data from a company called Surgisphere. And it turns out that Surgisphere is, no one had really ever heard of it. It's got a little bit of an unclear provenance, as we might say in journalism or elsewhere. And it turns out that they can't provide the data. They say they can't provide it. It's actually a little bit unclear whether it exists or not. No one can quite tell the difference. But that's all by way of saying that even the big journals, in other words, even all these brand name journals, these prestigious journals that I think as reporters, certainly in the health and science space, we have been trained or brought up to think, kind of don't get things wrong. You can trust them. They really fell for these studies. They were published, got lots of fanfare. One was about hydroxychloroquine. I'm sure you're all familiar with that drug. And so it's a good example of what I think, and maybe if it's a little bit of lesson that we can all take away from, any particular study, any single study is, I would say, not worth paying attention to. It doesn't mean you shouldn't report on it. Doesn't mean you shouldn't sort of write a story about it or write a story about something that's related to it and put it in context. I think that's actually very important. But to change policy, which again, the WHO, World Health Organization, actually changed policy based on, first, the publication of this study of hydroxychloroquine, which said it had no effect and that it had lots of side effects, which again were things that doctors knew, but nobody had sort of put into one big place together. So they paused a trial that they were in the middle of because the paper was published. And then days later, when the paper got what's known as an expression of concern, which is a sort of often a pre-retraction, if you will, it was eventually retracted, they actually started the study again. So that's just a lot. If you think about it, WHO actually falling for that, a big journal falling for that, as reporters, I hope that we wouldn't, or at least would have some skepticism. But frankly, a lot of reporters did, and it's hard not to. I mean, we're in the midst of a pandemic. We all want progress, scientific progress. We all want a vaccine. We all want to leave our houses on a regular basis. We all want all of those things. And yet, we're relying on these single studies, which I think gets to your point. It's great to be able to look at some of the older work, like you mentioned, in terms of transmission with eyes, for example, and whether or not that's a risk, because that work at least has been around a little while so people could kick the tires on it. The problem with the latest study is always, well, what do you do with that? And in fact, again, in my work at Retraction Watch, in addition to the 2 retractions I mentioned, we've actually reported on 22 different retractions now, just obviously in the last couple months about coronavirus. And we have a whole database of 22,000 retractions, which, if I'm to offer a little bit of a maybe self-serving tip, even though it's a volunteer activity for me, we're happy to provide to any scholars or journalists who want to bore through that. We've actually, a couple of times a year, a reporter will contact us for that and dig into the data in a way that, frankly, we're not set up to do. But I think based on what I'm hearing, a lot of you are, and I'd love to talk further about that to anyone who's interested. But I think that, in general, what you need to do in terms of studies is, it's the old trust but verify, right? And so was the study published anywhere? Or is someone just sort of announcing their findings? Is it actually in humans? A lot of studies that come out, and these are very important studies, by the way, scientifically, but they don't necessarily tell us anything about what will happen in humans, are done in animals, or done in the lab. That's one question. If it was in humans, how many people actually were involved? I don't think I'll be preaching to the choir a little bit to say that you should look for conflicts of interest. Are people who did the study, are they funded by a manufacturer or the manufacturer's competitor? I mean, these are all sort of questions to ask. And I did, in a piece that I think Eric is sending around, try to put all these together in a little bit more than I can, obviously have time for now, in CJR and Columbia Journalism Review, try and give you a sense of I think there's a dozen questions I always ask about every study. And I think to Anu's point, this, to me, it does not require a degree in epidemiology, right? You don't need to have super data skills, and I'm sure a lot of you do have. And I happen to have a medical degree, that's all fine. But I'm not an expert in any of these things. And I think these are surface level questions that can actually tell you a lot about the study. And the other thing I just want to share is, in terms of, this is all, and in many ways, it's because of the work I do at AHCJ, Association of Healthcare Journalists. It's, really, it builds on that. That's where I learned. I mean, don't tell my medical school professors, but that's actually in going to AHCJ meetings where I learned how to read studies critically, frankly. And so that was 20 years ago, almost 20 years ago now. And what we offer is, again, tip sheets. We have a whole topic area, topic champion, leader in reading medical studies, who's been doing it for many years, like me. She has a weekly, actually more than weekly, sort of blog posts and all sorts of resources like that. We offer access to journals because a lot of these require you to pay for them, for example, and that's something we offer. We have a listserv which has all of our members on it. It's a closed listserv only for us. But if you need a source, or if you need sort of an understanding to understand what something means, you throw out a question and boom, within an hour or two, you've got a really good answer. I know we're all on deadline and need to be looking at timelines. So, and all of those resources, by the way, are available again to members. But during the pandemic, we are offering to anyone who might find themselves on the medical coronavirus beat. Sort of, you can take a 6-month membership, which is obviously cheaper, and actually get all the resources, and hopefully you'll stick with us, but at the very least you sort of train yourself. Because what I really think is that, and I know this may sound, how can you say this given that we're in the midst of a pandemic and we're all on deadline all the time? Right now is actually when we need to start preparing for the next pandemic. There's going to be another one. I can't predict when. I don't know where it's going to come from. I don't know what it's going to be. I'm really quite sure that there's going to be another one. And so the best time to learn is, again, hopefully in advance and hit the ground running, even if there's always going to be new changes and what have you. So that's sort of our approach to this.
And Ivan, it is a tremendous organization, and it has been around for a long time, AHCJ, and it has had strong relations, again, with some of the strongest investigative bodies in journalism for many years. If people want to join or become a member, what does it cost, and how can we do it?
Yeah, so it's there are a couple levels of, so I don't want to get into, not just in terms of time, I don't want to hear from everyone else. So healthjournalism.org is the site. You can go there and there's a membership tab and find out about the different classifications and categories. If you're a working journalist, freelance, staff, etc., you would qualify for sort of full professional membership, and that runs typically about $65 a year. But again, we have the 6-month sort of half price of about $30 a year. Again, we welcome anyone to join, get involved, click around the site to make sure it's useful to you. We're pretty confident that it will be, and I'd be happy to answer any other questions about that too. Thank you.
Thank you. Good reminder that if you do have questions for any speaker, again, you can go into the chat section and go ahead and type them in, and we will respond as the questions come in. But Ivan talks here about how there will be another pandemic, and the importance of preparing could not be more important. Morgan Baskin, you're here with us as a grantee of FIJ. Morgan, you recently published tremendous reporting in the Washington City paper on the Child Welfare Agency in Washington, D.C., and how they have responded or failed to respond, failed to plan for this pandemic, despite what your reporting showed that they had plenty of warning signs and plenty to do, that they could have done more in advance. You picked this apart meticulously. I want to just give you the floor. Can you tell us a little bit about this project that you did? How did you get the idea? And very importantly, as we hear about this, there are people that are local reporters all around the country that might be listening in. If there's any data sources, records, human sources, how you develop them, that they could repeat in their own communities. I think there's a lot of people that can learn from your very smart reporting.
Thanks so much. So just briefly to overview some of the reporting that I did, I like you said, looked at the Child Protective Services Agency in DC to see how the agency responded to the threat of the pandemic. And I found 2 main areas of concern. First was that in terms of the social workers, there was very little clear guidance early on, even months into the pandemic, about what sort of preventative steps they could be taking to make themselves safer while they were working in the field. In fact, it wasn't even until April that the agency began to order what social workers were told were N95 masks, but were actually knockoffs that had failed a number of CDC trials. So that's obviously concerning because the frontline social workers who are making contact with some of DC's most vulnerable children were just frankly not prepared. Many of them were buying their own medical supplies. And like I said, it wasn't until April or May in some cases that many social workers received real PPE from the agency itself. And then the second issue with that obviously is that the kids that they're serving, they're very likely to come in contact with this virus that because of the makeup of a lot of these neighborhoods, they're much more susceptible to getting and to dying from. There were a few cases where foster children who had tested positive for COVID were kept overnight at the agency's headquarters, which is, a violation of the agency's own protocol and a violation of an agreement that it had made with a federal court. So there are just a number of examples throughout the last few months, I think, where the agency really failed not only, its most vulnerable frontline workers, but also the children that it's supposed to serve. And I initially got the idea for the story because of a source. I was a beat reporter for the city paper for a number of years, and I wrote a lot about housing and homelessness. And a couple of sources that I knew who worked, who are CPS workers who work at the Child and Family Services Agency, had reached out really early on in the pandemic and said, look, like, the mayor has declared a state of emergency and we have no idea what we're doing. We don't know how much time we're allowed to take off. We haven't gotten any supplies. We don't know what the proper protocol is. How scared should we be? I mean, they were panicked, frankly. And so it was hearing that I think it was then my job to say, okay, who is making the decisions here? What kind of guidance is the agency getting from the city's Department of Health? Are they following CDC guidelines? And so I think the most important thing that I had to do was just really piece together a timeline of, who was making decisions at the agency, when were they made, and did that really live up to the agency's mandate to help the city's most vulnerable kids?
So Morgan, we have a question that's timely placed in the chat about, we want to know more about the process of investigative journalism, what you're doing. So you get a tip as a reporter that and you get onto this story and you start digging into it. How do you go about getting information? Because this is a story that clearly the agency that you're reporting on does not want to have out. So can you run through the tools that you're using and what you're actually doing to penetrate this agency so successfully as you did?
Sure. So I will start off by saying that at the beginning of the public health emergency in DC, the city council actually pretty much put a full stop to filing Freedom of Information Act requests. And in fact, in DC, typically the agencies have a 15-day response period. And that has all but gone away. So usually I rely on FOIAs a lot to help me with investigative reporting, as I think a lot of people do. And that was just not an option here. I filed a number of FOIAs throughout the course of this investigation through the police department and through CFSA itself, the Child Protective Services Agency, and I still haven't heard back. So knowing at the beginning of this investigation that I wasn't going to be able to rely on a lot of my usual tools, I think made me sort of have to recast how I was going to approach this. So after I got my initial tip from a source who, like I said, I've worked with for a long time, I've known for a number of years, I just started calling as many people as I could who I know work at the agency, no matter what capacity they serve in. So it's a very large agency, but within Child Protective Services itself, there are only 4 or 5 dozen full-time employees. So, those employee records are available online. Most city agencies are required to upload those, or that information will be public. So I would just say, start running through them. If you know one source in an agency, ask them who else they know that might be willing to talk with you. And just keep calling people until you can get a really strong number of people who are confirming what you're hearing. So with me, I reached out to, I would say probably 2 dozen social workers. I heard from probably 6 or 7 of them who were willing to talk with me with varying levels of attribution. And from that point, it was, okay, how many of these people have stories where there's a paper trail that I can document what's happening, and how do I get, how do I give real credence to what these people are saying? And it was at that point that I started asking for the agency's call logs to show how much contact they were having with children. I started calling, I looked online actually, because DC has a tool where you're supposed to be able to see through the city's contracting office how much money the city is spending on things like supplies. So ostensibly, if the city was spending, $5,000 on disposable masks, that is something that you'd be able to see online. City wasn't updating that information. So then it became a hunt of trying to track down the vendor who sold the city those supplies, asking the vendor for photos of the supplies that the company sold to the city. So there's a lot of moving parts. But for me, it just started with hearing from sources that I've known for a long time and trusted, and, casting my reach outward.
2 questions to follow up before we move on.
Sure.
Number one, for those who are out there who want to do what you have done in their own local community to look into their child welfare agency and how they're doing, are there very specific names of documents or particular documents or data sets or kinds of sources that you can say, hey, if you're going to do this tomorrow, if you were plopped down into another city on the West Coast and you wanted to start this all over again, what would the specific documents be that you would ask for immediately or try to obtain, whether it's through FOIA or other means?
So there are a number of things. First, I would just ask for receipts, right? I would ask the appropriate city agencies, whether it's the Department of Health, the fire department, the EMS, the homeless services agency. What have you spent on supplies? How many medical masks did you buy? How many gloves? Is the vendor that you use your typical vendor? Because a lot of cities, because there's been such a run on supplies, have had to turn to less trusted sources to acquire their supplies. And I think that's where a lot of jurisdictions have gotten in trouble. So just really basic information, like what did you buy, when, how long did it take to get there? Would also highly suggest that people ask their child protective services agencies for call logs. How many calls to the hotline have you received? What's the percentage increase or decrease compared to this time last year? You can go, a number of cities are reporting great information from their local ERs about the number of really bad child welfare cases they've seen there. That's information that should be public. So I think starting with basic questions really gives you a good lead, because things are happening so quickly and so dramatically across so many different agencies.
And I just want to not let this moment pass. You alluded to it in your comments that many of the people who are impacted by COVID in the child welfare setting are people of color, people that are African Americans, and that is something that the people in the child welfare agencies that you're reporting on, they would come in contact in these populations. But what have you learned here? Because if we're reporting on COVID-19, what is the lesson here? This is a disease that is affecting in overweighted ways Black Americans. What have you learned about that through your reporting? What are the stories that we all should be reporting as we try to highlight this and stop it from happening either now or in a future pandemic?
So absolutely, you're right about that. And I think that's, just reporting on housing in DC, we know it's true that Black Washingtonians are far more likely to have high rates of asthma because of the bad conditions of public housing. Something like 92% of homeless families in DC are Black. So this is an issue. This is a racial justice issue in DC. We know, for example, that because the vast majority of homeless folks in DC are Black, that the shelter, more people should be looking at the shelter system and issues of overcrowding in congregate settings like shelters. So I think that there are a number of lessons that we can take away from this, which is, it's not necessarily that this is a new problem. It's just highlighting longstanding existing issues. And I think cities like DC and across the country. So look at how your public housing agencies are responding to this. Are they taking the appropriate steps to clean communal settings? Same thing with homeless shelters. Are folks who have shown symptoms of COVID being quarantined? Do they have places to socially distance? Same issues with jails. So I think that, any of these areas where that there are issues of racial justice and where Black folks are disproportionately affected by this, it's ripe for reporting. And I think that the pandemic has highlighted a lot of those issues, but it's not at all a new one.
Great tips from Morgan Baskin with their FIJ funded tremendous reporting. Thank you for your reporting. Look forward to continue to see follow-ups and impact roll out from that. Throwing it over now back to Anu, who has the pleasure and honor of being able to lead a conversation and learn from Derek Kravitz.
Derek, thanks for being on this panel today. First of all, thank you for the great FOIA work you guys have been doing. It takes so much effort, patience, and perseverance to do that. Having done a fair share of FOIA, I know how painful it can be at times. So thank you for that. Could you start off with just describing your project and what got you started and what kind of documents are you seeing right now?
Sure. So I've in previous life I was a research director at ProPublica, the nonprofit investigative newsroom based here in New York. And about a year and a half ago, I received a Brown Magic Grant over at Columbia, which is a sort of a joint program between Columbia and Stanford universities, marrying computer science programs and journalism in efforts to try to build new tools that can be used in the public interest. And I had worked on a project at ProPublica called Trumptown, which is a sort of a massive data set of political appointees in the Trump administration. And we spent a lot of time trying to automate and digitize government records and government documents from federal agencies. But we realized in March, just like everyone else, that COVID was upending everything, and that we needed to pivot and need to get a handle on it if we could. So we have a team of computer science students and journalism students at Columbia who went to work filing requests and doing so in very targeted ways with looking at local and state health departments and governors and what have you, and really asking for a variety of materials, including hospitalization data, email correspondence, underlying attachments, calendars, all the way up to reopening plans and other things. And it became readily apparent that a lot of newsrooms across the country, because they've been decimated by budget cuts, don't have the time or in some cases the money to actually, a lot of states still charge, unfortunately, for media requests. And so we found sort of a need to fill. And so they've been working hard at, I think they filed 100 requests so far and have produced probably 500,000 pages of material that we're about to proactively post online after a careful redaction process of our own, on top of what sometimes lawyers do. And a lot of stories in the Times and the Post and local publications in Colorado and Kansas and Nebraska and elsewhere about meatpacking plants and issues with reopening and Mardi Gras in New Orleans and various other sort of issues that have popped up, including with hotspots. So that's sort of the 30,000 foot view of what we're trying to do.
How can people find these documents, and is it searchable? Are there tips to search for local reporters? Are they easily searchable by state or area or something like that?
So once we launch the site, hopefully this week, it's fairly user friendly. You can search by state or tag if there's a theme in the materials that sort of runs through it or is mentioned prominently. It's also, with the help of Document Cloud, it's keyword searchable if it's in PDF form. But a lot of materials are not in PDF form or not machine readable, not OCR'd. So you have to go through this process of taking things that are in very difficult mail formats or PST, EML, other non-readable formats and export it or make it available for direct download. But the goal is to try to make it visible and readily available to local newsrooms in particular. The national media outlets, including the Times and Post and ProPublica, they're shared on a Google Drive we have that's housed on my Columbia server. That's all well and good, but they're the only ones that have access to it at the moment. So the goal is to make it sort of clear and fair for people and especially newsrooms that maybe this is their daily beat and they need to sometimes they don't have the extra $150 to pay for a records request for their county commissioner or their health department director. And so we want to try to make those available. And it in Kansas and other places, it's really become very apparent what the need for it. There was a list of every outbreak in Kansas across the state that we found, and the local health departments refused to make it public. And we found 3 time snapshots of those outbreaks. And the Kansas City Star, in collaboration with the Wichita Eagle and a few other states or a few other newspapers, started publishing that. And that's the type of work that I think is really important to sort of level the playing field and have the public and news organizations understand what's happening in their own communities.
What kind of agencies did you target, just to give the viewers an idea of what they can look for?
Sure. The typical government agencies that everyone deals with in their sort of local lives, whether it be the DC Health Department or local police, for incident reports, or if you're looking at a county commission, if you're looking for not just minutes, but email correspondence between commissioners and the public. In some cases, governors or state health departments. That can be a bit more challenging, but as long as you're careful and targeted and very mindful of the language you're using, and also fight and negotiate, and don't let a large bill or a sort of a difficult sort of back and forth with a FOIA officer dissuade you from extracting sort of important materials that are needed for the public conversation.
Is the FOIA process different now than usual?
Sure. A lot of places have shut down their FOIA function entirely. A lot of local and some state governments, including Louisiana and Hawaii. There are others that are using COVID as a way to, and frankly, I mean, it's not inaccurate. A lot of places simply don't have the resources in order to fulfill these requests. A lot of health departments are strapped as it is. So it can be a challenge. We've dealt with health department directors where, they're working 10, 12 hours a day, and then they're asked to, go through their email for a few hours and print out, in some cases, because they don't know how to digitize the emails, 600, 1,000 pages of records, and then mail that to us. That's a challenge on their end. That's not something we want. So, working with them, sort of giving a tutorial on how to make these readily available or easier to transmit.
Thank you, Derek. Whenever this is available, we would all like to take a look. So let us know.
And if anyone on the call needs specific help in a specific local jurisdiction, state, county, please let us know. We are open to help and brainstorm and do whatever we can.
Thank you, Derek.
We'll go to Q&A now. Quickly, Derek, what's the best way for people to reach you or your team if they do want that kind of help?
Sure, and I can put this in the chat as well. My direct email is derek.kravitz@columbia.edu. We should have the website called documentingcovid19.io up in probably the next 2 to 3 days. And then from there, we have a team of researchers who all of their contact info will be online.
Great. The first question that I wanted to toss out to you all actually came to us from one of the Association of Healthcare Journalists members who emailed us this morning, wanting to make sure that we asked, and this might be Derek and Anu, and then we can open up to others. How can journalists report on how much capacity hospital labs and commercial labs have for testing? And effectively, the person went on to explain, we know how many tests are being done in each state, but we don't know in each state how many tests could be done. And how do you kind of get at that number or chase that down in order to show kind of what's possible against what's being done, if you guys have suggestions for how to approach getting some of that information?
Short answer is I don't know the best way of doing this, but I know that the testing capabilities is a moving target and is a fast changing one. And every day there is a list that the FDA puts out of approved testings, and that could be a way to start. And within that data set, it tells you the capacity for each of those tests and each of the companies that are doing the tests. I think it also tells you how long the test results take. But that's the only data, and we haven't used it because we don't really I don't know. I'm not sure it's the most trustworthy data, but that's the only thing that's out there.
The FDA approved labs, yeah, there's the capacity that they have to provide the feds. At the state level, it depends on the licensure function there, and then private labs are a whole nother ball game that I have yet to figure out. But we get back a lot of sort of very interesting, very confusing sort of numbers and materials about those. So.
Those who are in the audience right now, if you do have very specific questions that you would like to be answered right now as opposed to privately, you can of course continue to ask your questions via chat here as we head towards the end of the session. Eric, are there others that we've received from email you'd like to go to right now? I think you're muted.
Yes, this might be an interesting one to start with, Ivan, for and it's one that I think comes up well beyond the COVID-19 issue. But one attendee would like to know, how do you present fact-based science to a fractured readership where some people just no longer accept facts and science? And we can talk about the latest data and clinical trials and the majority opinions of professionals in the field, but people have been told not to trust that information. And so what suggestions do you have for reporters on how to present information to such a fractured, polarized audience?
Yeah, it's a great question, and what it has to do a lot with is frames. And there are a lot of people who are much. I'm not a sort of communication scholar. I'm a journalist like all of you, so I don't claim to understand the field as well as I might, but as well as these folks do. But there's a lot in terms of framing. Just to give you an example, obviously nothing to do with COVID, but if you look at sort of data on how people respond to climate change, I mean, this is obviously a subject that people are, that some people find very, very polarizing. Well, for certain audiences, they may have been told that that's all, it's a myth, or it's, the government or someone is sort of making the data up or spinning the data. But if you talk to certain audiences that actually are in that group, but you talk about conservation, all of a sudden it's a very different conversation. And so sometimes it's a question of sort of, again, finding that frame. I mean, one example, again, within health would be, people talk a lot about mammograms, for example, and screening for breast cancer and screening for all sorts of other cancers as well. I don't want to single out breast cancer here, but what they often don't talk about is the sort of downsides of a lot of that testing. And so instead of us as journalists finding that single case that we all seem to be very good at finding, which is the person whose life was saved because they had access to something or because they had a test, you can never prove that. I won't get into the statistical details of why that is, but I'm happy to another time. But at the end of the day, you can't prove that. But what you can also show is people who are harmed by maybe a test that they didn't need to have, or a complication of it, or something like that, or a treatment that it didn't help them very much and was maybe very toxic, or harmed them because they had a test that they may not have needed, or it wouldn't have helped them very much. So I think often it's the frame, and so maybe it's, again, masks are a great example. I think there's so much confusion, and I think we have to blame ourselves as journalists, but we also have to blame, government agencies who are very unclear, who I think it's fair to say, flip-flopped, or at least we're inconsistent. Well, what's the frame there? Is it that you're trying to prevent yourself from being infected? Is it that you're trying to prevent others from being infected? Is it just that you're trying to sort of, have everyone have a lower level of risk? Different people are going to respond to different kinds of frames like that. And I think that we do want to be realistic, but also not be nihilistic about, well, that means we shouldn't even bother with facts, which unfortunately is where some people go with that. I think we can think more about frames and think about what's going to be meaningful to people based on, where they're coming from.
There is a question that came in through the chat about what are the biggest challenges covering pandemics and how do panelists overcome them. I want to maybe ask you to roll this in and give the final word here as we come to a close on this tremendous panel to the journalists who have done the recent FIJ-funded reporting, Morgan and Derek. Morgan, to start with you, perhaps, maybe rolling that in on biggest challenges of covering pandemics, but I'm also curious if you could touch on each of you, please, where not only how do you overcome these challenges, but when you're looking for smart stories, when you think about what are the stories that you're going to pitch next week or next month, what are the habits that you're following and the sources that you're going to try to get these story ideas right now?
Well, I think broadly, one of the biggest challenges was just hearing not only from my sources, but also from government agencies, the excuse of, well, we just never experienced anything like this before. If there's an issue, it's not malfeasance necessarily. It's just that we don't know, we're making this up as we go along kind of thing. And to an extent, as Derek pointed out earlier, I think that's certainly true, but it is also, I think, hard to sort of follow your instincts or to lean back on what you know to be true about people that you've maybe covered for a long time when, everything's just sort of chaotic. So I would say, have documents to back up what you're doing. Like it's so important to double and triple check, I think, everything that you're reporting. And, like Anu was saying earlier, if you have data, don't just assume that because it's a number that you figured it out yourself, like go to a second source and confirm that you're interpreting something correctly. Because I think with a public health emergency, there's an even higher burden to be accurate and fair and precise.
And Derek Kravitz, same question to you as we think about your biggest challenges. You've certainly figured out how to manage these disparate, large data sets that are out there. But I'm interested, as I hear how you've overcome the challenges, I'm also interested to get inside your brain. What are you doing when you wake up? What are you reading? Where are you going? Who are you talking to on a daily and regular basis to try to get smart stories to incubate?
We try to read every major coronavirus sort of piece that comes out in any state or local publication and all the nationals, just to stay on top of everything. And we have a computer science student who's very gifted, who's developed his own script for how to plot a 7-day or 14-day moving average of case counts and positivity rate to sort of get a sense on what the evolving hotspots are, so that we can more, target our FOIA requests to places that are starting to see warning signs. But one thing I think is just useful across the board to anyone who's trying to work with public records and maybe hitting a roadblock with an agency or several agencies in their hometown or where they're working, is triangulate, is think about public records as being sort of a network analysis of documents out there. And if you know the 6 or 7 people who are CC'd or agencies that are CC'd on a particular email chain or documents, or who are shared those documents by protocol or just by listserv or what have you, that's a really good way of, when you get the closed door on one agency, you might find an opening with a different agency. So triangulate.
Such tremendously good information, and the good news for everybody who is still with us here today is you can expect, for your time and investment in this webinar and registering here, you can expect an email that's coming in from the fund that will summarize all of these great tips with all of these links that are in our chat right now. You don't have to furiously write them all down with your notepad. We'll give this information to you in an email that will hit your inboxes shortly. I want to thank again Ivan at AHCJ and remind folks about what a tremendous resource that organization is. Their resource page that you can again visit at healthjournalism.org/COVID-19. It just in general, AHCJ is a tremendous resource. And for those of you who either right now or in the near term will come up with a story idea and you say, hey, gosh, it would be great to have a little bit of money or mentorship or legal support on, FIJ is there for you. We want your grant applications. As Morgan and Derek have shown, you can use our resources and produce all kinds of varying different types of journalism. We really want to support in this important space. Reporting on COVID-19, we want to support you in your work. Please go to fij.org and we'll also send you a note on how to apply and how to get these these grants. We are atypically for us not making people wait for quarterly applications. If you apply today, you literally could have money 10 days from now. So we really encourage you to do that. And I want to just thank all of our panelists today for all of your very generous time. You know, I'm just I'm in awe, and I've learned quite a bit. So thank you very much.